Hi, good afternoon. Good afternoon, ladies and gentlemen. I'm Janet from DKSH, and I'll be the moderator today. Today is an educational public forum in collaboration of iMedics Specialist Eye Center and DKSH with two interesting topics, which is red and itchy eye and understanding glaucoma. Let me introduce the speaker for today, Dr. Terence Song Guan Wei is a founder and medical directors of iMedic Specialist Eye Center. Dr. Terence is specialized in vitreoretinal and macular surgery, advanced cataract surgery, medical retinal disorder, including diabetic eye disease, retinal vascular disease, and age-related macular degenerations. Over to you, Dr. Terence.
Thank you, Janet. Good afternoon, everyone. Hope everyone is well. And today as Janet has said, together with DKSH iMedics, I myself have decided to have a brief talk about red and itchy eyes, which is mainly due to allergic conjunctivitis, and also to enlighten all our listeners about glaucoma. Selamat petang semua. Harap kamu orang selamat. Hari ini kita akan bincang tentang gejala mata merah dengan penyakit glaucoma. So, for the first talk, we will talk about red and itchy eyes, which is very common, especially in this day and age. Let me define what conjunctivitis is. First, it's a general term for any inflammation, redness of the conjunctiva. What is the conjunctiva? Broadly speaking, the conjunctiva is the thin, transparent layer which coats your eyeball, which is mainly the white part of the eye that you can see on the diagram. There is another part of the conjunctiva which, when you pull your lower lid and upper lid, it's also coating the skin around it. It's a transparent layer. So when someone says you have conjunctivitis, mata merah, or in Mandarin they say hong yan zhen, it shows that your blood vessels within this tissue swells up. It becomes fat, and therefore it looks red, and sometimes for severe cases you can feel or even notice that it's swollen. Usually it's associated with some stickiness or pus. Now, conjunctivitis can be divided into many different types of conjunctivitis, but not restricted to what I am going to present. So, broadly, we can divide it into bacteria, which of course is caused by bacteria. You have various bacteria, such as the common flu-like bacteria, and also some common bugs that we get on dirty surfaces and things that are not hygiene. Now, bacterial conjunctivitis is highly contagious, as if one has actually experienced it, it can start in one eye and it can infect the other eye, and if not careful, you can share it with your friends and family. Virus is another pathogen, another bug that actually can cause red eyes. It actually accounts for most of the acute red eyes. Now, viral conjunctivitis, in my later slides, we will be able to differentiate it from all the other red eyes, is that it's also highly contagious, but it has different signs and symptoms, slightly different from the rest. The talk today is to focus on allergic conjunctivitis. It usually presents to people who have history of allergies, and up to 70% of patients who present with allergic conjunctivitis has also allergic rhinitis, which is sesama atau or what they call pizza. Now, of course, there are various other causes of conjunctivitis which are more serious and associated with other systemic disease, which I will not cover today. So, how can we tell the difference generally between all this? In the early stages, conjunctivitis of whatever cause is difficult to differentiate. However, there are a few signs which may be able to suggest the actual cause of this conjunctivitis. So this is a picture of someone who's got bacterial conjunctivitis. As you can see, there is redness at the white of the eye. There is a little bit of swelling as well at the white of the eye, along with watery eyes. Now, most patients with bacterial conjunctivitis can start off with a little bit of pain and discomfort around the eyelid. And when you press on the eyeball, you might feel a bit of tenderness. Mungkin kalau tekan sikit-sikit ada rasa tak selesa. Usufu. Now, the predominant symptom of bacterial conjunctivitis is the purulent discharge, the pus. You will wake up the eye very sticky, full of discharge, and you might not be able to open the eye on your own. You might have to use your finger to pry your eye open, especially in the morning. There is lid crusting overnight. That means at the corner of your eye, you will get dried up tears or dried up discharge. Now, viral conjunctivitis is slightly different but similar to bacterial conjunctivitis. It's such that it causes redness and watery eyes as well. However, the predominant symptoms is a watery discharge, more of tears. It's usually associated with what we call upper respiratory tract infection symptoms, which is usually cough, cold, and sneezing. So now we go to our main topic, which is allergic conjunctivitis. Now, allergic conjunctivitis at its early stages as well is difficult to differentiate between the previous two conjunctivitis which I have spoken about. It causes also redness, tearing, watery eyes, and also swelling around the white of your eye. You will get eyelid swelling around the lids. But the predominant symptoms is itching. It really feels itchy, and most people would want to rub it most of the time. as I've mentioned, is associated with upper respiratory tract infection, so it can come with a bit of nasal congestion and also sneezing. Now, allergic conjunctivitis affects up to 30% of the world general population. So it is quite a common affliction to the public. So what happens when in your body when you have allergic conjunctivitis or any form of allergy? Now, the mast cell is part of our immune system. What happens is the antigen, which in terms of allergic conjunctivitis is caused by an allergen, which binds to receptors in these mast cells, which is part of your immune system. And its reaction is to release a chemical called histamine and other mediators, which also is part of what we call the allergic cascade. Histamine, the chemical histamine will in turn cause itching through nerve stimulation. Another effect of histamine is it causes the blood vessels to enlarge, to dilate. And that is why for any kind of allergic reaction, you get swelling and also redness. Histamine, in fact, will also lead to fluid leaking into what we call the extravascular space, the space outside the blood vessel. So all this in turn gives you the typical symptoms of allergy, which is itching, redness, and swelling. So what are the common allergens? Dust, pollen. So in countries which have seasons, you will get it more during spring and summer. Mold, especially if you have some rooms or a roof which has not been cleaned, or an attic where you have a lot of mold and mildew, because all these mold, they can release spores. And also smoke. There are more common, there are other allergens apart from this, but these are the more common ones that is usually presented to us in our daily living. Now, what's the impact of allergic conjunctivitis? It is ranked second most bothersome symptoms of allergies after your runny nose due to allergic rhinitis. So, allergic conjunctivitis can cause emotional distress. If your allergic conjunctivitis is short-acting, it's temporary. But for those who actually suffers chronically, they have to deal with it for many hours during the day. It can be emotionally draining for them to deal with the symptoms. So, and if you are working, the effect of allergic conjunctivitis can decrease productivity, as you are spending most of your time trying to deal with the disease or the symptoms. Whether it's the medication that you take or the disease itself, it can lead you to tiredness, time off work, and especially for those who are working on a desk job, it the symptoms of allergic conjunctivitis will decrease your concentration during your work time. And this in turn can lead to economic burden to either your own company or your country. Now, what's the impact of allergic conjunctivitis on children? If severe and long-standing, it can lead to what we call corneal erosions. The cornea is the frontmost window of the eye. If you have any irritant, for example, due to allergic conjunctivitis itself or due to chronic rubbing, it can cause what we call irregularities at the front of the cornea. As you can see in the picture, the yellow greenish little dots and specks are the irregularities on the cornea, which ideally should be clear without these yellow dots. So it will lead, as I said, it will lead to constant eye rubbing and also watery eyes. For children in particularly, this is shown to increase astigmatism, rabon silam. Your sangkwang will increase if you rub your eye too hard and too long. With increased astigmatism, of course, it will cause blurred vision if not corrected with spectacles or contact lenses. It can cause glare, and for those children who is in their visual developmental age before the age of 8, it can lead to what we call lazy eyes, which is the 懒拖眼. For the most serious case of increased astigmatism, it can lead during later life in the child's years, especially during late teenage years. It can develop what we call a condition called keratoconus, where the clear window of your eye swells, bulges outwards, and you will find that even with your spectacles, you will find it difficult to correct the underlying astigmatism. Usually at this stage, you will need more advanced management, such as contact lens, or even in the extreme case, surgery. Now, what's the primary management of allergic conjunctivitis? What you should do when you first notice yourself or any of your family members or friends has signs of allergic conjunctivitis. Of course, you've got to avoid the allergen. If there is pollen, you need to close the windows. If you can't help it indoors, such as pets who sheds hair, such as cats or dogs, you need to make sure that you clean their fur off your furniture and your house, your floor. You can add things like an air purifier to purify the air, and make sure that you change your blanket, your pillows, and even clean your mattresses regularly, because those are the source of dust mites and their sheddings, and that is one of the main causes of allergy, whether it's which will cause allergic conjunctivitis or allergic rhinitis, runny nose, or even it can trigger serious problems such as asthma. For kids who have stuffed toys in their bedrooms, either make sure they are cleaned or remove them from their bedrooms. You can get artificial tears from over the counter from your local pharmacy. You can instill these artificial tears into the eyes to relieve the symptoms because it can dilute and wash away the allergens and thus improving the symptoms. In addition, you can use a cold compress to make your eyes less swollen and feel more comfortable. It is a natural decongestant. Cold compress, not warm, because cold encourages your blood vessels to constrict and thus reduce the swelling and the redness. What can we do if the above does not help? Of course, you can go visit your doctor to get some medication for the allergy. There are many different kinds of medication in the market. There is the antihistamines, the decongestants, there are combinations, there are the mast cell stabilizers, and there's combination of antihistamines and the stabilizers as well. Your doctor will be able to prescribe which he or she thinks is appropriate for your conjunctivitis. It can be topped up or alternatively given some oral medication to relieve your allergy. Now, how does a decongestant work? Let's get back to the slide which I put up earlier regarding the process of an allergy. A decongestion, it stops the blood vessel from swelling up, thus reducing redness, and it also reduces the leakiness of the blood vessels, thus reducing the swelling. It acts on the end organ, as you can see in this diagram. So it reduces the redness. It has a limited effect on itching, as you can see. It just affects the blood vessel. Now, when you stop this decongestion, you can actually have this condition called rebound vasodilation, where the redness actually gets worse than what you start with. Now, the other class of drug is the topical antihistamine, which it acts, as it says, antihistamine, it acts on that chemical, that main allergic reaction chemical, histamine. So if it acts on the histamine, it will reduce the itching and it will reduce the swelling of the blood vessel and also the leakiness of the blood vessel. So, however, it does not affect the rest of the other chemicals that are released by the mast cell apart from histamine. So what's a mast cell stabilizer? Now, a mast cell stabilizer is mainly used to stabilize the mast cell so that it does not release all these chemicals too easily and thus stops the allergic cascade. So as you can see in the diagram, it is meant to stop your swelling, your itching, and your redness. However, it is usually slow acting it will take some time for the medication to work. And it's usually given as a prevention rather than a treatment on the spot. So your doctor might prescribe you more than a single eye drop to deal with your allergic conjunctivitis. Of course, there are the combination medication which will help in all of this allergic cascade. It's, it is meant to give immediate relief to patients, but also give a prevention so that you are not too sensitive to the allergens. Now, of course, for some people, despite using all the above medication, they still have allergic conjunctivitis. Usually, the eye specialist will then go ahead for stronger medications such as topical steroids. However, steroids have to be used judiciously, carefully. It has to be monitored, not to be abused, and not to be used without supervision. It is a fast-acting medication. However, it has its potential side effects, serious side effects such as increased eye pressure, which can lead to glaucoma, and also premature cataracts. That is why your eye specialist can prescribe this medication, but for short term only. So this is how the steroids work. It actually stops the other mediators that are released, the chemicals that are released from the mast cells, and thus improving all the other symptoms. The other form of therapy is immunotherapy. Now this is like very advanced. Immunotherapy is like a vaccine. What it does is they will inject a mild form of whatever you're allergic to, so that your immune system can get used to it, so that it does not produce such an exaggerated, a heightened immune system that will cause severe allergy. So to end this first part of the talk, remember primary management, which is most importantly, reduce the allergen exposure. That means cleaning your beddings, close the windows if there are external factors, constructions or renovations outside, or dust coming in from outside to the indoors. And you can consider investing on some good quality air purifiers to reduce this allergen exposure. Cold compress, as we have mentioned, is a natural decongestant. You can help relieve the symptoms of itchiness and also redness. The artificial tears is to wash or dilute the allergen so that you are not exposed to the full dose of the allergen. If all this fails, seek help of your local eye specialist. A note to parents out there and to carers: children with allergic conjunctivitis can affect their long-term vision, as mentioned earlier, if not treated appropriately. Thank you for attention. Stay tuned for the next discussion about glaucoma. You can leave all your questions at the end of this forum. I will pass it back to Janet now. Thank you.
Thank you for informative talks on the topic of please call your and to any question before we continue the topic that uh, the uh, thank you from the University of Manchester, UK, and has trained and worked with the UK's National Health Service for many years. He underwent a subspecialty fellowship in vitreoretinal surgery and retinal disorder in Adelaide, Australia. In Malaysia, he practiced as a specialist at the University Malaya Medical Center and is at Selayang Hospital in Selangor. So that about the speakers we have for the educational forum today. Dr. Terence Tong, now let us continue to learn more about glaucoma in this lovely afternoon with the second presentation by Dr. Terence. Back to you, Doctor.
Hi, good afternoon. Thank you, Janet, again for the kind introduction. Now we'll go on to our second part of our presentation. We welcome those who have just joined us. Selamat petang. The next talk will be about glaucoma. Now, you have heard this word glaucoma sometimes being put up, before this pandemic, there are a lot of societies or NGOs who organize glaucoma screening, or you might even hear once a while your relatives, especially the older ones, mention the word of glaucoma or 青光眼 in Chinese. So what is glaucoma? It's a chronic eye disease. It's a disease that is long-standing and it's progressive. That means it continues to damage the main nerve at the back of the eye. And this is irreversible. That means whatever's damaged is damaged. And the end stage is it will cause serious vision loss. It is one of the most feared eye disease among eye specialists. As I mentioned, is the leading cause of irreversible blindness. So who are at risk? You all are probably looking at each other now, saying, am I one of them? You are at risk if you have high pressure within the eye. This is usually you will only know if your eye pressure is very high only by seeking and getting your eye checked by an eye specialist, or if it's extremely high, you will have very severe symptoms, which I will discuss in my subsequent slides. Family history, if you have a direct relative who has been diagnosed or is under treatment for glaucoma. Usually it affects people who are older. Your risk increases after you are 40 years old. It is not impossible to have glaucoma before the age of 40, but it is less common compared to the glaucoma, which I will discuss today. A thinner central cornea. A cornea is the clear window in front of the eye. For some people, the cornea is thicker or thinner compared to the average person. We will be able to know only by visiting the eye specialist your eye specialist will use a special equipment to measure the thickness of your cornea. Some races are more susceptible to glaucoma, such as Afro-Americans and unfortunately Asians. And those people who have other systemic disease, such as diabetes, this will put them at an increased risk compared to the average person. So what is normal intraocular pressure, which is the eye pressure in the eye? It is between 10 to 21 millimeters of mercury. That is what your eye specialist usually measures and make sure that it's between this range. Patients with glaucoma often has eye pressures higher than normal. However, this is not completely applicable to everyone. The absolute value is actually less important than the increase of that person in its normal value. That means if that person is supposed to have a normal value in the low teens, so an occasion or multiple occasions where it's borderline around 21 and 22, you may actually be suffering from glaucoma. And eye pressure actually varies throughout the day. It is typically highest in the morning and it reduces a little bit as the day goes by. So what are the types of glaucoma? As you can see in this slide, it is classified anatomically as open angle, narrow angle, close angle, and others. Primary glaucoma usually means that there is no obvious cause of glaucoma. Secondary glaucoma usually means that there is a discernible reason, such as steroid abuse, chronic steroid use, other diseases, diabetes, advanced cataracts. All these can cause secondary glaucoma. So let's talk about primary open angle glaucoma. As you can see, the white arrows in this slide, it shows the outflow of the fluid in your eyeball. The fluid in your eyeball is constantly being recycled. It goes through a cycle where new fluid is produced and the old fluid, after providing nutrients to your eye, it's being washed out of your eyeball. And there is this mechanism which actually maintains the eye pressure in the eye. Now, for primary and open angle glaucoma, it means that there is a resistance. There is a resistance of the outflow of this fluid. This is the most common of glaucoma. Because of this resistance, the fluid gets accumulated and the eye pressure will increase. Normal tension glaucoma is when your eye pressure is within the normal range. However, for some people, the optic nerve, which is the main branch of the nerve of the eye, it gets damaged even if your eye pressure is within the normal range. Its exact reason is unknown. Now, closure glaucoma is when there's a sudden rise in intraocular pressure. This happens when the brown, blue, or green of your eye, the tissue kinds of bulges forward and it blocks that drainage angle which we were talking about, that is supposed to drain your fluid, but it's completely blocked off. When it's completely blocked off, the eye pressure builds up very quickly, within minutes or hours. With this rapid buildup of eye pressure, you will experience symptoms such as a severe headache. You will get blurred vision suddenly, eye pain, and if severe enough, you will get nausea and vomiting. So most of the time, this condition is mistaken as other conditions such as migraines or even some more serious pathology in the brain. This is a medical emergency because, as you can realize, this rapid buildup, apart from causing distress and discomfort, it can rapidly kill off the optic nerve and cause permanent blindness. So this is the symptoms of glaucoma. At the beginning or early stages, you might not notice anything because your vision is normal, and even in early glaucoma, only slight peripheral, the vision at the side of your field of vision is affected. And most of the time, but not always, glaucoma affects one eye more than the other. So if you have a more serious glaucoma on one eye and less on the other eye can compensate for the worst eye, and thus giving you a false assurance that your vision is normal. And of course, as glaucoma advances, your field of vision comes more restricted and constricted to what we call tunnel vision. End-stage glaucoma will result in complete blindness and black. So your eye specialist will actually look at the back of your eye with his equipment to see if your optic nerve is damaged, and he or she will evaluate it by doing other tests such as the visual field test and also some scans. So as you can see on the left of this slide, where the optic nerve is healthy, which gives you a normal visual field, and as glaucoma progresses, the black part of the visual field is the loss of your vision. So as your optic nerve gets damaged severely, you will lose your field of vision. Whatever optic nerve fibers that is lost cannot be recovered. So, glaucoma in an early stage may not cause any symptoms. So, regular comprehensive eye examination is crucial in diagnosing and detecting glaucoma. Once you have been diagnosed glaucoma, treatment can be discussed and initiated to treat this devastating condition. So how do we usually diagnose glaucoma? We will, of course, ask about your family history. We will check your eye pressure with specialized equipment. We will look further and examine the rest of your eye with a microscope. For those who has the specialized equipment, we will measure the thickness of your cornea. Everyone will get their optic nerve examined and sometimes photographed, and your doctor might suggest that you should have a visual field test. And also possibly an optical coherence tomography scan, which actually scans the back of your nerve, your eyes, to see the nerves, to see whether there is early damage due to glaucoma. So what is the treatment goal when you see your eye specialist? The treatment, as we have mentioned before, any nerves that has been damaged cannot be recovered by any treatment, be it eye drops, laser, or surgery. Any modality of treatment is to preserve maximal functional vision throughout the patient's lifetime. Of course, using eye drops can be quite bothersome, so we have to consider their quality of life, and glaucoma eye drops are not cheap. They can be quite costly to some because it usually has to be used throughout their life. So as we have mentioned, again, the treatment is to preserve whatever healthy nerves that you still have. So how do we treat glaucoma? At the moment, the current trend is to reduce your eye pressure. We have to individualize the treatment to each patient. Treatment usually consists of using eye drops first, and if eye drops doesn't work, your eye specialist might suggest surgery, either by using laser, by using a minimally invasive device which helps increase the flow of your fluid from the eyeball to the external eye, or implant certain devices to drain this fluid. It is not exclusive to each and single procedure. Your eye specialist might suggest one or two or more of these procedures, or even in combination, to achieve the eye pressure of desire. So, in summary, get an eye examination by your local eye specialist to screen for glaucoma. Remember, there is no cure for glaucoma. Early detection and treatment will prevent or retard further damage of your nerves from glaucoma. Encourage your family members to get an eye examination, especially if they are over 40 years old, if you have been diagnosed glaucoma. Not all blurred vision is due to cataracts. Be wary of medications in the market, especially from direct sales, multi-level marketing, or even online, claiming that they are able to cure or treat glaucoma. If you're not sure, please consult your local eye specialist to get confirmation that these medications are approved for glaucoma treatment. Glaucoma is also known as the silent thief of vision. So protect your eyes from this sneaky disease. A well-known ophthalmologist says the only way to predict if there's a cloud on your horizon due to glaucoma is to get tested. No matter what the diagnosis, the forecast for clear vision for the years ahead of you. Thank you very much for your attention. We can now take questions.
Once again, thank you, Dr. Terence, for the two informative presentations on allergy, conjunctivitis, and glaucoma. Ladies and gentlemen, if there's any questions to ask, please feel free to comment at the comment sections below, and the questions will be answered at the end of the sessions. Okay. So let me share with the question. Okay. We have few questions available. Question one is on I have a 2 years old niece at home and realize she's frequently have the habit of blinking excessively, occasionally rub the eyes. Is this signs of allergy?
It could be a sign of allergy. As we have mentioned earlier, allergic conjunctivitis is usually associated or it comes with a rhinitis. That means runny nose or signs of allergy such as sinusitis. However, other conditions can cause frequent blinking and also eye rubbing. Conditions like dry eyes, or even sometimes for Asian kids, I have realized that sometimes they have this condition where the eyelash is actually turning inwards and rubbing on the eyeball, thus causing the itchiness. So the best option is to visit your local eye specialist to get her examined to see that if the excessive rubbing and blinking is due to allergy or other causes.
Okay. So there's question number two is will wearing mask during this COVID-19 pandemic helps or cause allergy?
Okay, this is more to our current situation. The Of course, it will depend on the quality of the mask. Most masks which are of good quality, by wearing a mask, you not only reduce your risk of catching the COVID virus, but also it prevents other allergens from entering your nasal passages, your nose, so that you won't have the symptoms of allergic runny nose, which in turn can affect the eye due to the connection of the sinuses to around the eye. However, saying that, masks which are of poorer quality and also have been, disposable masks which have been used many times, they can actually produce little plastic or the fibers which can actually lead to the nose allergy.
Okay. So there's question number three. This customer is asking, do the dehydrations can cause red eyes?
Okay, if the definition of dehydration, I would presume for what the audience meant is if you did not drink enough water. Now, of course, severe dehydration can cause this, but I think at this day and age, and especially in our country, we do not get that kind of severe dehydration. I would think that your question would say that drinking not enough water can cause red eyes. I don't think it's a direct correlation. However, if your environment it's dry, say for example, if you are in long haul airplane travel, let's say like from here to New York or to the UK continuously, in an environment where the air is dry, caused by either compressed air or even air conditioning or even fan. Uh, yes, all this can cause dryness on the surface, which in turn can lead to red eyes.
Okay. Another question is patient is asking, why do we get the itchiness eye in the first place? It it is due to sinus.
Sinus, as I mentioned, if the allergen trigger is being triggered at the nasal passages, it will it will invoke the allergic cascade. For some fortunate people, it might actually stay just at the nose and you will just have allergic rhinitis. However, if the nasal passages are connected to your sinuses and your sinuses surround your eye. So, in fact, if the allergic reaction goes up, you will get allergic conjunctivitis at the same time.
Okay. Okay. Should I the another question is this customer is asking, should I avoid too much sun exposure to protect my eyes become red?
Sun protection is good for it's beneficial to the eye for many reasons. Okay, not just for allergic conjunctivitis or red eyes. It's beneficial in terms of preventing, slowing down the process of cataracts, and also it is known that increased UV uh, may actually accelerate the aging of the eye. So in terms of red eyes exposure to sunlight, uh, you if there is intense UV, like if you are staring at the sun directly, or anybody who is soldering, yes, it can actually affect the cornea, and if the cornea has erosions, it can cause red eyes. So yes,
Okay.
protection from sunlight or bright lights, whether it's blue light or UV, it's definitely beneficial to the eye.
Okay, so this is another viewer is asking, is there any home remedy to cure this if can avoid taking medication?
Mm. Sorry, cure.
Uh, I think these questions are because the viewer just said cure. I think maybe it's about allergies or
Oh,
um
okay, okay.
okay.
Uh, the in terms of allergic conjunctivitis, home remedy, it's difficult for me to recommend any home remedy as many different cultures have their own beliefs. However, Uh, as we have mentioned, we can try things, primary first aid, such as washing the eye, the allergens of the eye by using artificial tears, uh, or using a cold compress to alleviate or let the symptoms of to make the symptoms of allergy less pronounced, and also to avoid the allergens. The actual important thing is to avoid the allergen. There is not much use for any remedy or any treatment if you still have that chronic exposure of the allergen.
Okay. So this will be the last questions on red and itchiness eyes. Follow these questions we will discuss on. This question is asking, can take loratadine tablets for allergy conjunctivitis?
Yes, you can. Loratadine is an antihistamine. So the when you take antihistamines orally, it actually works when it kicks in. It actually works throughout your body. So if you have runny nose, it helps with the runny nose. If you have itchy eyes due to allergic conjunctivitis, it can also help. And if you have a little itch on the skin of in your hand or your back, it will also deal with it. So yes, loratadine can help with the allergic rhinitis and also allergic conjunctivitis. However, just to note that oral antihistamine can cause dry eyes. So dry eyes will give you similar symptoms of redness and itchiness as well. So if you are planning to take oral antihistamines such as loratadine, try not to take it uh, for prolonged periods. That means maybe for about a week. Uh, and at the meantime, try to organize to get your allergen exposure reduced.
Thank you. So below sells a few questions to the patient would like to understand more on glaucoma. So the questions number one is asking, is laser treatment safe? What is the best treatment for glaucoma?
The, the treatment for glaucoma is rapidly advancing. There are new developments, new devices, new research is coming up every year. Now, in terms of which treatment is the best, there is no one treatment that tops the other. Your your eye specialist will individualize your and cater your glaucoma to the treatment, because not all patients who has laser treatment for glaucoma will work for them, and not all surgery will work for the laser patients or for the patients with the eye drops. The first line is eye drops for most specialists, because it's non-invasive and it's relatively safe. Treatments such as surgery, of course, they have what we call surgical risk. Your personal eye specialist will discuss all these risks and benefits with you before recommending the treatment or the treatment management for your glaucoma.
Okay, thank you, doctor. So the next question is asking, my mom have glaucoma. She is currently on treatment. Can I get glaucoma as well?
It puts you at risk because your mother is a direct relative. So yes, you are at risk. You can get glaucoma. So you should actually visit your local eye specialist to get an eye screening for glaucoma, especially if you are above 40.
Okay. The last question on about glaucoma is, my grandpa suffering from glaucoma. Does he have to use the eye drop for life? Can he stop using it when he's no longer have symptom?
Now, that's the thing about glaucoma. Glaucoma usually does not have any symptoms. If you start having symptoms of blurred vision and if you have constricted field, by that time, at least 50% or more of your nerves has been irreversibly damaged. So, as your godfather is on treatment for glaucoma, he is likely to need the eye drops for life to maintain the eye pressure to an acceptable level. If he stops it, the eye pressure can silently, symptomatically increase until the day where he has blurred vision or when his vision is affected. At that time, it might be too late. So my advice is, if for reasons that he does not want to continue his eye drops due to inconvenience or financial reasons, it is best to discuss with your local eye specialist to see what are the alternatives.
Thank you, Dr. Terence. So we have come to the end of these sessions. If you have any further questions, you may call 088 532 462 or WhatsApp 018 291 300 for an appointment to meet Dr. Terence. So Dr. Terence and his team will be more than happy to help you with any issues affecting your eye. Thank you everyone for joining us in this forum. Thank you.
Thank you. Stay safe.